Ladies and gentlemen, welcome to my channel, Lifestyle and Fashion Tea. I have some breaking news. There is an outbreak of measles in many states. Yes, many states. This is the importance of the U.S. aid. It is very important. Please
School-age
listen.
child died of the measles in West Texas last week. HHS Secretary RFK Jr. downplayed the outbreak, calling it, quote, not unusual. Never mind the fact that no one had died of measles in the United States in a decade. Since then, though, the past week, cases are continuing to pile up, including in New Jersey. And now RFK Jr. is amending himself ever so slightly, writing in a Fox News op-ed, quote, this situation has escalated rapidly, and adding, quote, all parents should consult with their healthcare providers to understand their options to get the MMR vaccine. Joining us now is senior scholar at Johns Hopkins Center for Health Security, Dr. Amish Adalja. All right, Amish Adalja, I'm sorry. Measles vaccine. Can you say what RFK is refusing to say?
The measles vaccine is the solution to this outbreak, and RFK Jr. is kind of going around that. He's not really giving it a full-throated defense. He's giving it a very kind of anemic, kind of perfunctory type of position on it, when he should be doing what, for example, Trump's first HHS Secretary, Alex Azar, did during the first administration, where it was a very full-throated, very aggressive defense saying, this is the solution, this is the way out of this is why the outbreak occurred, but you're not really seeing that, and I think it's what you'd expect.
Why not?
I think it's because he's shown who he is for the last several decades. We know that he's an anti-vaccine activist. We know he is aligned with people who have said that the MMR vaccine causes autism. He wouldn't even disavow that during his confirmation hearings. He wants to make a statue to Andrew Wakefield, who was the guy who made that false statement. So this isn't somebody who actually believes in what he's writing there. I think he's written it maybe for political reasons, and that's what you're getting, is that kind of a response. That's what you would expect from someone like that.
So when you hear measles, you think, oh God, it's going to be something like a chicken pox. I'll get over it. I'll be fine if I get it. Or, most kids will be fine. Or if they survive it, then they'll be fine. There's some new literature out there, new studies that show that the measles does something that has longer term ramifications. Can you explain?
So the measles virus doesn't just cause a rash and a runny nose and red eyes. It actually affects your immune system. It actually deletes some of the memory that you have to other pathogens, other infectious disease. So after you get measles, your immune system is kind of crippled, hobbled for some time when it responds to any other type of infectious disease. So this is not something you want.
So it means like when you're a kid, you're building up a giant immunity, a set of immunities from all of the various viruses that you pick up in elementary school and you pick up in daycare and whatnot. And so if you get the measles and you survive it and you're 16 years old and you come across a pathogen that you would normally be able to overcome pretty easily, are you suddenly struggling?
Yes, your immune system, your immune response is blunted now. It's been sort of taken a couple steps back because of what measles has done. It's deleted, it literally deletes and kills certain cells that would be there to respond to those infections.
Okay, so remind us again, if you want to get the measles shot, you haven't yet gotten one, what is the normal schedule for measles shots?
So usually children get measles, the vaccine, between 12 and 15 months, and then again around 5 to 7 years of age. You can sort of adjust that a little bit. They're not ironclad, but those are the times when people get
How
vaccinated.
can you adjust it? Say you have a 3-year-old or a 4-year-old and you want to get them that second shot to build that immunity.
You can call the pediatrician and get it early. They can move it up. It's not really that big of a deal if they get it when they're age 4 or age 5. And certainly if you're living in an outbreak area, it might make sense to have the added protection. And remember, there's a bunch of people that didn't get a second dose because that second dose was added around late 1980s or so. So there's people that were born before then who got one dose, which is good, but not completely optimal. So if you're going to Texas, if you're traveling internationally where there's lots of measles, you may want to get that second dose as well.
What about a booster? I mean, would it be available to me if I wanted a booster and I had those 2 shots? Would it be necessary? Would it be helpful?
It wouldn't be harmful. I don't know if it would actually help you if you're already fully immune with 2 doses of the vaccine. This is one of our most effective vaccines. This is what keeps measles at bay. And I think if you're fully immunized, unless you've had some kind of immunocompromising condition, like you've had a transplant or something, there's no reason to get a 3rd dose of it, but it's not going to hurt you if you get a 3rd dose.
Using myself as the stand-in for everyone else. Dr. Amish Adalja, thank you so much for joining us.
The rural area of West Texas has now grown to nearly 150 cases, the state's largest outbreak in nearly 30 years. And this week, an unvaccinated child in Lubbock died from the disease, the first measles death in the U.S. since 2015. With more, we are joined once again by Dr. Anne Remoyne, professor of epidemiology at the UCLA Fielding School of Public Health. Dr. Anne, good to see you as always. We are seeing this now fatal outbreak in Texas. There have been multiple measles cases reported in New Jersey, Georgia, New Mexico, Alaska, and here in California, including an OC infant this week. Is there reason to worry?
Well, thank you for having me and talking about this very important topic. Measles is among the most contagious viruses known to man, and it is so contagious, for example, it can hang around in the room after someone has left for up to 2 hours. So that just gives you an idea of how quickly this virus can spread and how easily it's spreading. So that's why this is very concerning. It's also concerning because this virus can have a lot of severe complications. It's not just about if you get measles. If you survive measles, which most people do, there's this thing called immune amnesia, which means that it can actually affect your ability to have immunity to other viruses, other things that you've already had. So you're starting back at ground zero, and that's really difficult for children in particular.
Well, let's take a step back, because I'm sure people are looking at those images with the spots and wondering what exactly those are, what exactly measles is, and then what steps viewers can take at home to avoid contracting the disease.
So measles is generally considered a respiratory infection, which is confusing to people sometimes, I think, because they think about this rash, which is also important. You have high fever, cough, runny nose, you can have red eyes, and this very distinctive red rash that starts in the face and spreads downward. The way you can prevent measles, the most effective way is to get vaccinated. This vaccine is very safe, very effective. One dose gives you about 93% protection against the virus, and the 2 full doses give you up to 97% protection. So it is the most effective way to avoid getting this virus.
New HHS Secretary Robert F. Kennedy Jr. said this week his department is monitoring the situation, but called it, quote, not unusual, saying there have been 4 measles outbreaks in the U.S. this year, 16 last year. What do you make of that comment? Is there any truth to what he's saying?
Well, it's accurate that the U.S. does experience more and more measles outbreaks every year. However, this situation is not normal. It's particularly concerning because of its scope and its severity. As you've mentioned, you're already seeing 145 cases in Texas, 160 cases nationally. I think that the key, a death, which we've not seen since 2015. So while we usually have several outbreaks a year, this outbreak that we're seeing is very large, much larger than what we normally consider 2 or 3 cases at a time. So yes, I think that this is something that is, while regularly occurring, very different in terms of scope and severity.
Well, finally, real quickly before we let you go, you're director of UCLA's Center for Global and Immigrant Health. And this week, the U.S. canceled several contracts through USAID. So what's your take on this funding battle and what impact could it have?
Well, I mean, listen, USAID funds are essential for early warning systems, disease surveillance, vaccination programs, food security efforts. This is all critical stuff. And tonight we're talking about measles, but we've also talked about recently avian influenza in the US and globally, Ebola in Uganda, unidentified outbreaks of something we don't know what it is in the Congo, where I work. And reducing USAID's capacity means reduced situational awareness and weakened health infrastructure globally. So we live in an interconnected world. And as I usually say to you when we talk about infectious diseases, an infection anywhere is potentially an infection everywhere. So I think that this is something that we really do need to consider very carefully.
Dr. Anne Remoyne, good of you to take the time. Thank you.
Yes, as the reporter said, an outbreak anywhere is an outbreak everywhere. Please be sure you are up to date, as well as your children. Your children are a must. Be up to date on your shots. Do not let Robert Kennedy F. Jr. tell you otherwise. Like, share, subscribe.